Good afternoon, everybody. Welcome to our media Q&A session, our update on COVID-19 that we do once a week, talking through what's happening in Eau Claire related to COVID-19, as well as giving some additional state updates. Today is December 17th. Yesterday marked 9 months for us doing these COVID media briefings in one form or another. It's a long time. We've been working with you to get information out to the community, and we really appreciate the opportunity to make sure that we have good, solid updates available to people across the Eau Claire area. So thank you for doing that work with us. Thank you for really checking in about what's happening and going to sources of information on our website and with these updates that help people understand what is happening with COVID-19. We hope that these continue to be ways that people get information they need as our work continues with this pandemic. It's been a long 9 months, but an important partnership work across the community. We are going to take today to do a little update on what we share as well. We've been giving you a lot of numbers, a lot of data over the last number of months related to COVID-19. We'll still supply some of those at these updates, but we also encourage everybody to go to our COVID-19 eauclaire.org webpage. If you haven't been there, please go there. There's lots of really good information. It's updated every day by Audrey and the team that we have working on public information. In that webpage, there is a whole section, a whole tab that you can go to that includes all kinds of local data and ways to connect to state data as well. So if you are someone that loves numbers, please go to that page and you can get updates every day on what we know about COVID-19 in our community. So we will, though, start with some local data. We'll also share a bit of the state data, and then we'll move to additional updates. So for Eau Claire County, we are now at over 40,000 negative tests for COVID-19, an increase of 1,080 test results that have been received that were negative since last week when we spoke to you last. We now have 8,649 Eau Claire County residents that have tested positive for COVID-19 since the start of this pandemic, an increase of 323 individuals since last week when we spoke. We have an average of well over 45 cases a day now that we are seeing that are COVID positive individuals in Eau Claire County. We estimate that there are about over 475 Eau Claire County residents that we're actively working with right now that are COVID positive. That means that that number of people in the county are staying home, are isolated for COVID-19, so that disease does not spread across the community from that case. People that are infectious during that period of time, we know that they can spread COVID-19 very easily to other individuals that they're in close contact with. So one of our best ways to slow down the spread of disease is for people to stay home when they're infectious. Of those people that have been COVID positive, 267 individuals have been hospitalized, an increase of 10 people since last week. And we now have 67 of our Eau Claire County friends and family that have died related to COVID-19, an increase of 2 people since last week, Thursday. It's a large amount of individuals since last March, a slowing rate, but really one that we want to keep low. We also typically on Thursdays share a couple of other data points with you. So as of Monday, December 14th, so this past Monday, 350 individuals connected to the Eau Claire County Jail have been tested. 22 of those individuals were found to be positive, with 22 now recovered. About 15% of the cases since the beginning of September have been connected to UW Eau Claire. There are now 67 active public health investigations in Eau Claire County. Remember that public health investigation means that there are people in long-term care facilities. There's one individual associated with that facility that has been identified as a positive. For other settings, it's two or more individuals, connected individuals that are identified at those settings. 2 out of 3 of those public health investigations are in settings like education, workplace, or healthcare. The remaining are connected to long-term care facilities. Our positivity rate in Eau Claire County is at 11.4% by test. And again, that is slowly decreasing, and we are hopefully going to continue that trend over time. Do know, though, that our testing numbers are lower and have been lower for some weeks. This is true across the state. We talked about this last week. It is an important strategy that we have for COVID-19, and we really strongly encourage anybody that has any symptoms or that has been in close contact with an individual that is COVID positive, be tested. We have lots of testing resources in Eau Claire. I'll talk a little bit more about those in a minute, but it is important that our testing numbers stay as high as possible. That way we know when someone is COVID positive. Other measures to share with you, our hospital bed space, our capacity for hospitalization is improving greatly in the area, both at a local level in Eau Claire County and regionally. Both our bed capacity are in the green, both inpatient hospital beds and ICU beds. Those are measures that we track over time, and that's really good news for our community. Community spread remains at 35% or in the red category and has been fairly steady over time. The percent of cases that are identified in Eau Claire County that get that follow-up phone call within the first 24 hours is at 77%. So doing better, but still room for improvement. The last couple of weeks, because our case numbers have been lower, we have been able to contact the cases more quickly and more of the cases. And we are starting, as of today, really reaching out to close contacts of cases. So that's good news. That's the public health best practice. That has been something that we've not been able to do for a number of weeks now. And we are slowly starting to be able to get in touch with those close contacts. Again, remember that if you are identified as having COVID-19, that you are a case, please go to the website so you quickly know what you should be doing. Please talk to people that are in your household and that are close contacts of you very quickly, because it may take a little bit of time before we get that information and before we are able to reach people. The more quickly we get people to stay home if they are a case or if they are a close contact, the less spread we'll have. It helps everybody in our community, employers, schools, all of us, if we slow that spread of COVID-19. The state rate for COVID-19 in Eau Claire County remains at the very high level. Again, we're doing a lot better, but being at the very high level is defined by the state at more than 360 cases in 2 weeks. We are now at 691 cases in 2 weeks, better than we were previously, but the goal, again, is to get out of the very high, needs to be significantly lower than that. A ways to go, but doing better, and that's good news for Eau Claire. At a state level, again, the state is doing better, and that is also positive. Even though nationally cases are exploding, Wisconsin is doing a bit better. Our positive cases at a state level are at 448,441. The increases since last week, Thursday, are about half of what was there in the previous 7-day period. So more than 22,000 positive cases since last week, but again, much better than the previous week. We do have 4,255 Wisconsin residents that have died related to COVID-19. Again, a shockingly large amount, but we need to slow that down, and it appears that we are starting to do that, which is good news. State activity remains at very high, just like it is in Eau Claire. It's an improvement, but we need to keep working at it. A couple of announcements for you. Um, so the vaccine distribution has started. That is amazingly good news for our state. The state health department has been working with CDC and with the recommendations for distribution, and we've gotten dosages out in Eau Claire. I had a fun experience this morning on my early morning walk, which I've shared with all of you that I do. And someone who knows that I also do that early morning walk that often runs past me said, I got the vaccine yesterday. So we know it's happening. That is good news. 50,000 doses of the Pfizer vaccine were distributed through this hub and spoke model that many people have heard of. The hubs are places where they can keep the Pfizer vaccine at very cold storage. And the spokes are those vaccinators that have been approved by the state health department to give vaccine. They are starting to get that vaccine now and are starting to vaccinate, including in the Chippewa Valley. It's just a start. The local health departments are not involved in making decisions about who is an approved vaccinator or who gets the vaccine first, but the federal government and the state have determined where the priorities are. And appropriately, those priorities are with our healthcare workers that are working directly with those that are COVID positive and are in high risk situations of coming in direct contact with people that are COVID positive. They are prioritized in this 1A group that has been identified as being first to get vaccinated and have that opportunity. Healthcare workers and long-term care facilities across Eau Claire County will be getting vaccine first. That'll be distributed through the Moderna vaccine that's available and the Pfizer vaccine that's available slowly as the state has that available. Our role at the local level will continue to be to make sure that we have vaccinators that can give vaccine and make sure we understand all of the people that are in that healthcare worker group and in the group for long-term care facilities. We'll keep working on that and making sure that those people are getting the vaccine that are available. We do have a new spot on our website, the COVID19.org website, that is specifically slotted to talk about vaccination updates as we hear about them. The state also has added a spot on their website that is talking about vaccination. So as we have more information, we will be getting that out. We also want to share with you that testing remains a critically important strategy in our work related to decreasing the spread of COVID-19. We need people vaccinated and we need people tested, and that's going to happen well into 2021, which is right around the corner. So our two National Guard sites, we have a couple of updates related to that for testing. We've made some changes because of the winter schedule with our National Guard testing sites. The first is that the Augusta site, which has been happening on Wednesdays, it will continue on Wednesdays, but with slightly different hours. So rather than from 2 p.m. to 7 p.m., we've shifted that to 1 p.m. to 6 p.m. So Augusta site will still continue and is available to all of you to get tested at by the National Guard. It's just shifted an hour earlier. We also have moved our National Guard testing site, that is the regional testing site that's been in existence out on the west side of Eau Claire County, right off of Highway 312 or the Highway 1294 interchange. That testing location has moved to Peace Lutheran Church in the city of Eau Claire, off of Hamilton Avenue. So the same testing hours, again, Fridays, Saturdays, and Mondays, but at a new location. So if you previously used the site out off of West Highway 12, we now have a site that is also a regional site available for people to exit off of Highway 94 or Highway 53 and get into that convenient location at Peace Lutheran Church. We hugely appreciate East Lutheran being willing to work with us on that location. It does have the requirements that the National Guard needed in order to have a little coverage and a little heat available to them as they provided as they provided testing in our community. We also heard today that the Memorial High School antigen testing site that UW Eau Claire has been facilitating will be available in January. They have testing slots available through this week, Sunday, and then they'll be back and running in January, likely at that location as well. We still, as soon as we get confirmation of the dates for that testing, we'll get them up on our website, so that's available for everybody to know about. Today, Governor Evers announced the availability of a new smartphone application in Wisconsin, which will be the Wisconsin Exposure Notification app. They've been working on getting that tool available to Wisconsin residents for the last couple of weeks, and that will be rolling out soon, we understand. Governor Evers announced that today. The app is another tool that other states have been using to help people, if they choose to have that app available on their phone, where if they become a positive, they can then make sure that anybody that came in close contact with them, using the same definition that we've been using all along, which is that 6 feet for more than 15 minutes, that those people would be notified via a Bluetooth connection about that potential exposure so that they could be encouraged to be tested. It is all anonymous. It is really only if people choose to add the app to their phone. We encourage people to consider that when it's available. It's another way that if we are out and about in the community that we could know about a potential exposure. We also want to let people know that we continue to watch the data as it unfolds in our Eau Claire County to look at our community expectations document. We continue to use that document as we talk to facilities and individuals about what we need people to do to keep spread slow. We know that that has made a difference in our community, and we will continue to look at that expectations document. If the data continues to look as encouraging as it has the last couple of weeks, if we continue to get case numbers down, we will hopefully be updating that document after the new year with the ability to do more in our community. Our individual actions and our business actions make a difference with this disease spread. We hope people continue to follow those expectations over the next number of weeks so that we can slowly encourage change in what those expectations are. We also want to take a minute to spotlight mental health again. Holiday times can be really tough for people that struggle with mental health issues. Being 9 months into the pandemic, many people have been working at an elevated stress level for a lot of months. This is now coupled with things like shorter times where we have daylight available to us and the usual stress of the holidays. I want you to know that we see that and we know that that is hard. We also encourage people to use the resources that are available. There are many resources on our website, but I also would want to call out specifically the Hope Line resource that's available. That's a text resource. If you text to Hope Line 741 741, it's a free and available 24/7 texting resource that I hope people take advantage of if they need that. Finally, an update that is not COVID related, but we want to take the opportunity to talk about other health issues that are important in this community. Every 3 years, we do an updated community health assessment with partners. That includes United Way and all of our healthcare institutions in the Chippewa Valley. And every 3 years, we do a survey of residents across Eau Claire County to ask them about what their top priority health issues are. That survey is available right now. We hope to get a great response rate like we have in the past. It's a bit.ly survey at CV Health Survey, and we hope people complete that. There is information available on our social media sites and has been broadly available across the media, we hope people follow those links and complete that survey as well. So with that, again, an encouragement to go to the COVID-19 eauclaire.org webpage, to call our call center if you don't get the information at that website that you need. That number again is 715-831-7425. We will have people available during the holiday time to update the website and to answer questions on the Christmas holiday and the New Year Day holiday itself, not having accessibility to updates, but other days we will. We will also be doing our media update next week, Wednesday, rather than Thursday. So a couple of questions from the media in advance. And then if media has questions that have come in through the chat box, Audrey, I'm sure will share those with me. And we can also open it up to questions at the very end. So first question, if you get the Pfizer shot for the first shot, if you are someone that is in queue to get a Pfizer vaccine, would you be able to get the other brands for the second shot? The vaccines are spaced apart. Again, a reminder that it is a 2-shot series for all of the vaccines that are going through the approval process or have been approved to date. That vaccination process counts on people getting the same vaccine for both of those shots. So if you get a Pfizer for the first, you get a Pfizer for the second. And that's true of both the Pfizer and the Moderna vaccine that will be available in this community shortly. A second question, now that the vaccine is here, can you describe in more detail what's happening behind the scenes in Eau Claire County to distribute and prioritize the vaccine? So I will share with you that the state and the federal government set the priorities for who gets vaccine. So the federal government is sending the state allocations based on the priority of healthcare workers and long-term care workers. The state then is distributing that vaccine out, as I described earlier, to with the Pfizer vaccine to the hubs that are able to hold that vaccine. There are 8 hubs in Wisconsin right now that are able, because of the extreme cold storage, to take that vaccine in. And from there, the vaccine will be distributed to what is being called the hubs to the spokes. Those spokes are approved vaccinators that the state has approved through their process. At a county level, we're not involved with determining who the spokes are, but we are working as spokes are identified, as vaccinators, approved vaccinators are identified. We are working with that group of vaccinators. We have a meeting starting tomorrow to really talk to our healthcare partners and approved vaccinators about how the rollout is going, how they are making sure that within their provider group, so their healthcare worker group, how their things are going for them. We are also identifying unaffiliated healthcare workers and unaffiliated long-term care settings to see how we best vaccinate those people. So we are partnering with healthcare providers and vaccinators to really look at those unaffiliated groups in Eau Claire County and start prioritizing how we get vaccine out to them once we have vaccine available. We don't yet have vaccine available broadly in Eau Claire County. It's just right now going to a specific number of healthcare settings and long-term care settings eventually. We locally will meet. Our role is assurance. We want to match providers of vaccine with those that need it, and we will continue that work as the rollout happens from the state level. We know that there are some healthcare workers that are not affiliated with those large healthcare settings that right now are starting to get vaccine. So dentists, EMS workers, school nurses, home care agencies, those will be the next round of healthcare workers that will be working together on making sure get vaccinated. We also know that rollout of vaccine to the next group, the 1B group, as the state calls them, essential workers, that'll be the next group that will be prioritized for vaccine. probably a little bit later in January and early February. As vaccine is available, we'll be working together with partners across Eau Claire County to make sure that those essential workers also can get vaccinated. And then the same process will happen as we get more vaccine available for the general public. Health department will likely be playing a role in vaccinating, but at this point in time, we have not received vaccine, and we will be working with partners to make sure a vaccine gets out as it's available. We also received a question about any comment on the first COVID-19 vaccine doses being administered in Eau Claire, and what does that represent in the Chippewa Valley? It's really momentous that we have vaccine available in the Chippewa Valley, and it's starting to be put in arms. Healthcare workers, as was announced yesterday, got vaccine, and that's good news. This really is a new next step in responding to COVID-19 in our community and across the state. We've not in our lifetimes ever had a vaccine that has rolled out this quickly and needs to get out this quickly in order to protect our population. So it's started, and it will seem slow maybe to all of us initially, but as we get vaccine in arms across the Chippewa Valley, it's a good thing for our businesses and our schools. Vaccines are a success story in the 20th century. We have diseases that no longer do we really have to worry about in the US because of vaccination efforts. And we hope soon to be able to say that about COVID-19. It's going to take time. We're looking forward to that time, but we need to get a large pool of people vaccinated before we are able to say that um, it's a success story. So we're looking forward to that, and we will be all working hard to make sure that that happens, and counting on all of you to get vaccinated when that time is available to you. So there's also a question about any messages to the public we'd like to share about how to act before and after receiving the vaccine. I know there's a lot of hope by many people in Eau Claire County about the vaccine being available. It's going to take a while before it is available to everybody. Until that time, my primary message to people is we need to stay strong with those basic of COVID-19 prevention. We need to keep distance. We need to wear a mask. We need to get tested if we have any symptoms or have been in close contact with anybody with COVID-19. And we need to keep our circle of close contacts as small as possible. That's what will help us. Slowly, when the vaccine becomes available, we need to get vaccinated. I know I will be encouraging that regularly through this forum and through all of the networks that I have. When vaccine becomes available to you, please get vaccinated. It will help keep our progression through responding to COVID-19 as strong as possible. For those that get vaccinated, it takes time to get that second dose on board. So the first dose, get the second dose when you are in line to get vaccinated. And once you get vaccinated, know that we still expect people to wear masks and keep distance. We are still learning about this vaccine and how much protection it will have for prevention of spread of COVID-19. It certainly has shown amazing promise quickly in decreasing the illness of people that may get exposed to COVID-19. It's brand new. We'll learn a lot over the next several months, and it's an important step in the process. We finally got a question in advance about doing offsite full-scale vaccination exercises. What did that involve? What did we learn? How are we hoping that we're using those kinds of sites in the future? For the last number of years, actually, we've been doing what we've called mass exercises for flu vaccine that happened the last few years. It happened again this fall. We've shared that with you that most recently at North High School in November, we were able to do a mass vaccination, actually recently, a mass vaccination clinic to do that as a practice for big clinics for events like COVID-19. So we've been doing that with flu, and it has taught us a lot about how we'll do that if we need to do it for COVID-19. We anticipate that when COVID-19 vaccine is available to the general public, that we'll be working with healthcare and pharmacies to make sure that that's available like we do with influenza. And we are guessing that in order to get it out quickly, if we have vaccine available, that we will be doing also mass vaccination clinics through the health department for people that need to get vaccinated. So we've learned a lot. We expect to set up those mass vaccination sites likely sometime this spring when the vaccine for COVID-19 is available for the general public. And we'll be letting the public know about that as soon as we have that available. It'll likely happen very similar to what we've done with flu vaccine, where we'll find settings where it's safe and efficient to get many people through and out with COVID-19 vaccine as well. So at this point, without any other questions that came in advance, Audrey, are there any questions that came in via the chat box?
There aren't any questions in the chat box today. Does anybody have any questions that they would like to unmute and ask directly?
Hi, Lisa, this is Sarah from the Leader Telegram. Can you guys hear me?
Yes.
All right, thanks for taking my question and all of our questions. I just had a question about the Christmas holiday. You know, right before Thanksgiving, you were telling folks, hey, not the best idea to gather with your family. We didn't really see that post-Thanksgiving spike in cases, and our cases are a lot lower than they were in November, but are you still encouraging folks to not to gather in big groups at Christmas time?
Yeah, thanks for that question, Sarah. So we are entering for many people the Christmas holiday, which many people in this community celebrate with typically family and friends. I do, I know. And just like with the Thanksgiving holiday, we still have COVID-19 circulating. We still have a lot of cases of COVID-19, more than 50 a day that are bubbling up in our community with testing. We are still encouraging, as is the state and the national level, to really just celebrate our Christmas holidays and other holidays that happen around this time of year with our smallest circle possible. The fewer people that travel, the fewer people that really meet with those outside of their household or other outside of their closest immediate family, the fewer spread of cases of COVID-19 that we'll have. It seemed to have worked, as you said, with Thanksgiving. We did not have big spikes in case numbers that could have happened if people celebrated in the normal ways with Thanksgiving. And we're hoping that that happens again, that we keep our case numbers as low as possible, that we keep immediate family gatherings only for Christmas and for those holidays that happen in the next couple of weeks. And we slow the spread again in the Chippewa Valley. People did what looks like to be a great job in Eau Claire County with that, and we really are counting on that happening again with the Christmas holidays. Any other questions that people have? Again, thank you for joining us. We really appreciate the media working with us as we try to get good information out about COVID-19 in the Chippewa Valley. We will be back again next week with a briefing, and we hope that people between now and then go to our website and contact our call center if they need additional information. Thanks, and we'll be closing for today.